Hi, this is my protocol for COVID that I found using applied kinesiology examination and chiropractic adjusting. So this morning, which is October 3rd, 2022, I was in a situation where I was in a hospital. That's can be talked about at a later date. No worries about that. So the process is that the unit went under quarantine because of a COVID outbreak or a COVID positive test. So isolation had to be maintained on the unit. So the unit about 25 to 26, and then 6 or 7 staff given a revolving shift of 2 shifts per day, 2 to 3 shifts per day. So about 26 patients and then 6 staff, 6 to 7 staff. So what had happened is I'm not too sure where it starts. That regardless of point, no names to be said or whatever. So waking up, we had breakfast, and shortly after they started testing. So it's currently 1 p.m. Eastern Standard Time on that day that I'm saying, October 3rd, 2022. Before lunch, there was, and regardless, it's not that they're doing something wrong with testing or not testing, so leave that as such. They're not doing anything wrong, okay? Donning, all that kind of stuff, don't worry about it, okay? But the process is I am chiropractic trained, 2005 national grad in Chicago, Illinois, in Lombard specifically, a suburb of Chicago, Illinois, USA, Toronto resident, okay? So anyways, this after breakfast, shortly thereafter breakfast, I started getting scratchy throat and eyes that were sort of dryish and not hazy, but dryish, sort of the same as what you'd say a scratchy throat was. So if you look at a symptom outbreak or of COVID, you would see that some people have these, different symptoms. So I didn't have shortness of breath, I didn't have headache, but since 2019, this is where I'm talking about it. Since 2019, I had an upper cervical, meaning the upper part of the neck, right below where your mastoids are. Your mastoids are the bone that sits behind the ear, and it drops down and it curls around to the front where your jaw meets. So that's the mastoid. Right below that is your cervical vertebrae. The cervical is the first cervical vertebrae sits right below. Since 2019, when I did have a quote-unquote sickness, now I wasn't sick with symptoms, but I had a tight neck, or I've had somewhat of a tight neck, and I've been adjusting and thinking it was some kind of pattern with dietary. But anyways, regardless of that, 2019 I had about a 45-minute onset when I was out with family and friends at Disney on Ice. Is the first noticeable thing that I had anything similar to what people would have been calling COVID, but I didn't have it as such, or didn't recognize it as such. That morning, I didn't have anything, but once with my family, I noticed that I had, at the point in time leading up to and at the point in time meeting them, right at the point in time meeting them, I had some symptoms of what would be noticed as what you would may call COVID. I don't know. I appreciate it possibly as COVID. I don't know. It lasted. I did some therapy on myself, did some applied kinesiology on myself, a system of subdiscipline of chiropractic, and my symptoms went away within about 45 minutes period of time. Some people do get better from COVID quite quickly. Some people don't. Some people take delayed or even long, as they said in some literature. Case in point, close at that. So fast forward. Today, this morning, itchy throat and itchy eyes, but not itchy, but sort of like a scratchy eyes and itchy throat. And then possibly looking back, maybe I had itchy throat yesterday, but last night-ish. So possibly it was on the airborne in the unit. In the hospital, the unit is about a 200, maybe 200 by 50 square feet. 2 laneways of about 100 square feet with not so much. Okay, so anyways, After finding this morning that I had scratchy throat and like scratchy eyes and itchy throat, I went to my neck, started palpating again, and I noticed that the C1 this time, not that it was any different, but I noticed that at this point in time was fixed. So as I had been adjusting C1, which is the first cervical vertebrae, either laterally, adjusting it right to left because there's a right lateral, or a posterior, straight, move back to the right, twisted, so rotate it to the back, turn to the back with this would be the vertebrae at the front, twisted to the back. This is the back. You got to remember the camera is facing there, so it's shifted back to the right. So I'm going to push it from the back forward. But what had happened is, in my case, which may be noticeable of COVID, is that the first one was shifted back. On the screen, it would look, here, let's try to do this. How do we do this? If we're saying the right, this is my right, is what you're appreciating it as, and you're looking at me, that's not what I'm doing. I'm showing you the back side of me, and it's going back, even further back, if you can appreciate that. This is the front of the body, this is the front of the body, and the back are where my thumbs are. So the front is where my knuckles are, the back is turning backwards, so it's a right posterior, and then the other one is going to be also like that. It's going to be shifted as a group, so it's turning. If I'm doing, holy fuck, I can't do it. If it's going backwards, it's going, I can't bend my hands that way. Yeah, okay, like that, I guess. It's going back this way too. It's shifted back. So the thumb on my right hand, this is my right hand, is going back. They both move back. So it's a group. A subluxation is when one moves in position and needs to be adjusted. A fixation is when two or more in a group need to be fixed. Or not need to be fixed, need to be unfixed, but they are, in a group, they're messed up. They're moving as a unit where they should be moving individually and they're not. So a subluxation individual in applied kinesiology and a group is a fixation. So they're both shifted back in this side. Now, I don't know if there's more than one because mine just tested as 1 and then 2, C1 and C2, C1 and C2. C1 top, C2 bottom. They both shifted back on the right. So how do you test it? Now I'm going to show you, when you get the screen, this is a vertebrae. These are transverse processes. Transverse processes. They're the sides. If you palpate on the back, you put not in the center. Center is the spinous process. So transverse processes are the left and right, sort of what you would look in the lamina in the lumbar spine, but transverse processes in the neck and cervical thoracic spine. But in the neck, you're pushing on the back from back to front, on your body back to front, and you're finding the one that's fixed. The side that's fixed, meaning the side that's fixed, not the vertebrae that's fixed, the side that's fixed. So in my case, it didn't go. I'm moving into the screen. Remember, I'm pretending the screen is my back, or the back of someone. I'm my back, or the back of someone, and I'm pushing right to left, left to right on the back, from back to front, and then the left, back to front, back to front. Mine was fixed on the right side. All listings on how to adjust them are also on Twitter. The Twitter is at TSOHAMAHOS at but T, just singular, at T Sohamahos. So you're looking at the transverse process. You're moving it from the back to front and back to front. Mine was fixed on the right, so I'm labeling it as a posterior right. At this point in time, a right posterior, or at least the fixation side is the right side. Right side is fixed. Now then you go to the SP, the spinous process, which is if you're looking at my nose, it's the thing that's sticking out, and I'm going left to right, right to left like that on the spinous process. It was not moving left to right, so the right side is the labeled side because it wasn't moving. We had a right was the fixed. Now we're moving it left to right, and it's fixed, going left to right, so we're going to label it towards the side of fixation. So it's a right posterior, or right posterior. All labelings are going to be explained as such. Then, if you had a different fixation, it would be the other side or a different nature. You can have them, as I'm going to explain shortly, to adjust a right posterior, which may be the actual pattern, and then we'll get into foods and stuff and diets. It doesn't appear that it's this virus, at least if we're considering it a virus, doesn't appear to be a virus that's responsible or responsive to fasting, which means two things. One, fasting won't clear it, and two, if you resolve the fixation, at least in this point, if we're calling the C1 fixation complex part and parcel of the COVID variable, then the nature is that after I had adjusted, I did eat, and it doesn't seem like it reestablished anything. So that's fair to say. Fair to say that you can still eat after resolving the COVID complex, and we're going to appreciate that they're the same. Now, what I'm saying is that once adjusted, my nose, no, there's no nose, my eyes, which are the dry, itchy kind of thing, and my throat, which is an itchy thing, have both resolved immediately, right after the adjustment. There was a crack in my neck after I adjusted it to release it, and then my neck, there's no tension in my neck, and then both immediately, the tension in my neck resolved, and then my eyes cleared up, and my throat no longer itchy with a drainage that came pretty quick. Later on, I spat, and this is the next part of the protocol, which I'm going to explain right now, and then I'll get into adjusting in an extra video. Or later in this video. It's running on 11 minutes. Hopefully it's not too long. But anyways, the sputum protocol for viruses. So there's allergy complex, which is sort of like a virus, and there's bacterial complex, which is clean colored sputum. The process is no sputum at this point from now on. It's called the sputum protocol. Is when you don't spit on the ground, because as soon as you spit on the ground, it's releasing virus or bacteria and pathogen, and necessarily we're going to call pathogen into airborne and even onto surface area. Coughing in sleeves, we've done that for generations now. Essentially, you're coughing, sneezing into sleeves, that's smart. The next protocol is the sputum protocol. So coughing into us, like they used to do in the day, is coughing, but you don't look into it. As soon as you look into it, you're bringing consciousness. This is the key. You're bringing consciousness back into reframe into the system. Now, I'll tell you one thing. The mind does affect. The mind is affected and the mind affects. So the natural thing is to cough and look at it, or cough up sputum and look at it to see color or shape or whatever, to see how bad it is, even if it's blood. That's not it. What you do is you cough in it, close the Kleenex, and never look at it. So you cough and rip away, cough, or if you cough up, close, rip away, and pull out. That's the sputum protocol. Now on to adjusting in the next seminar.